Alright, hello everyone. My name is Lynn Simino and I'm going to be doing my semester project on gene therapy. So some of the course objectives that we are going to be looking at today are going to be identifying genetics and those that are derived from some microorganisms. So that would be things such as like viruses and stuff like that. We're going to explain the concept of gene therapy and we're going to summarize gene therapy. Now, most people ask what exactly is gene therapy because they have heard the word, words, but they don't know exactly what it is. Gene therapy is essentially an experimental technique that uses your genes to either treat a disease or prevent a disease. Here I have a picture, just a simple picture with healthy gene, and then if you add a virus vector, that's going to give you your healthy gene with the added virus vector, and in that human, it's not going to be too very good. They're going to get sick. So this could be with a monogenic inherited disease, such as cystic fibrosis. It's sort of common, not really everyone gets it, but it is. It's definitely, you could get it. And there's many other applications, but those require gene transfers, and those are like specific immune responses. So the application of gene therapy. Gene therapy can really just deliver target cell genes that code the missing, biological factor. So that could be, it's definitely, here it says terminal cancer. It's most of the time it's cancer. So whenever I think gene therapy, I would think something along the lines of maybe like treatments to cancer, such as radiation or chemo could possibly be a gene therapy because you are trying to treat what's going on. Other types of diseases could be like infectious diseases, or you can have cardiac disease, or even it's possible to treat neurological disorders or inherited conditions. Here, this is like we talked about CF, and there's also an immune deficiency, and this shows how the T cells are affected, and it shows how the infection is in the cells, and then how the DNA or the ADA gene gets corrected, and then your health may or may not improve, but it shows how the patient gets sick and then how they could improve. This has also been regarded as the ideal model disease for gene therapy. So whenever you think of gene therapy, think of this, this picture. Now, there's something interesting called, some people say CART gene therapy or CAR-T gene therapy, however you'd like to say it. But it has to do with T cells that have been genetically engineered to produce an artificial T cell receptor for use in immunotherapy. So it's very expensive, but it does. CART stands for antigen receptor T cell, and the therapy is for your relapsed childhood acute lymphoblastic leukemia. So like I said earlier, it's mainly, you can do gene therapy with cancer. You can also do other infectious diseases or just diseases. Since it is very, very expensive, other breakthrough drugs, for example, for cystic fibrosis, they could be triggers for sticker shock. Or what you could do is you could just infuse your own cells into the body and just kind of make them a little bit more healthier. But sticker shock is basically like a higher increased price. This infusion is often associated with a life-threatening cytokine release syndrome, which that could also be why it is so expensive. Then again, most cancer treatments are remarkably expensive. So where are we with gene therapy? I love this picture because it represents how far we've come with technology, and it kind of, to me, you can see like, oh, the future is in our hands, literally. But technology is so advanced, and there's really, you can just modify genes, or you can do new technology with drugs such as erythropoietin, and you can just speed it up how it is developed, how it develops. And you can also do different applications. So different applications could also determine how the therapy is inactive or if it does not work. But overall, gene therapy is really a powerful clinical approach, but it does lack some success, and that was kind of promised in the early days whenever it was released. But that fact has been seen as a failure of communication, which also results as a failure in technology. But since we do have greater technology and greater, we can get our hands on greater things now, and we can use so much useful tools, then this could really expand gene therapy and the knowledge that we have for it. Future developments in gene therapy, this kind of piggybacks off of the last slide, but I thought it was very important to put in here because they also, this site talks about, this is from What Has Happened to Gene Therapy, and it has talked about like how certain approaches to gene therapy are for disorders restricted from the liver. So gene therapy can be anywhere in the body, first of all. That's very important to notice. But this talks about how the advantages of RDR medicated gene therapy are that no new genetic material is introduced, but it's actually repaired. So think about it as if you were trying to fix something. You're not going to introduce something brand new. You're going to simply repair it. And then the repaired genes, or whatever you're repairing to keep the similarities going, remains under normal regulation. So nothing is changing, nothing is going crazy. But this website also talks about, well, this article is not really a website, it's a journal article. It talks about how you have these babies who maybe they have a genetic disorder, or they say damage. I like disorder better, it's a better word than damage. But you can actually, while the mother is still in whatever gestational week she is, it's normally in the middle of her pregnancy, if I'm not mistaken, but they will like go in with a needle and they will like make sure that the baby's genes and genetic disorders is taken care of. Some do not think that that is very safe, but they've been available for over 3 decades now. Well, the diagnosis has been, but some of the gene therapies for the child are now more common out of the womb, but they can do it in the womb. It's just they as in doctors, think that it's more safe to do it when the baby is born. So in conclusion, gene therapy is not just something routine. It is very expensive, as we have covered and seen. And the first report made it very clear that the application of gene therapy, and since the routine sense of healthcare is long off at first there was no communication. And now with technology, we can just explore gene therapy to the best of our abilities. And there's still many obstacles to overcome, once again, with our new technology. And different strategies can be implemented. And clinical research will be constantly done. There's always something to learn every single day about gene therapy and new diseases and how to cure them. And these are all my references. They are very good reads if you are very interested. Thank you so much for watching and listening. I hope you found this just as interesting as I did.